Well, welcome everyone, and thank you for joining. This is our annual tradition to meet together, celebrate the new fellows, encourage the people who will be applying for next year. It's very informal, so be ready with your comments, be ready with your questions. What I want to show is just a quick 4-slide presentation. So what I will do is try to share my screen and open, let's see. So Vajiha, you have to give the permission for that.
Okay. So let me do it. I'm using it on my phone. That's a little bit.
Okay, take your time. Yeah, no problem. Meanwhile, while Vajiha is doing it, well, congratulations, everyone. And thank you. I see some of the senior fellows and faculties here. And this is a collaborative effort. This is not just one person who does all this. Yes, looks like now I have permission to share my screen.
Perfect.
Can you guys see my screen?
Mm, so you have to allow all your screens.
Okay.
Yeah, now we can.
Okay, you guys can see it?
Yes.
Okay, good. Excellent. So I'll just take not more than 5 minutes. This is a peer-to-peer session, and what I want to hear from you guys is the theme about the leadership, and this should be for the long-term academic success. So these are the names of the people who have worked collaboratively with us, with the team, and congratulations for matching into all these prestigious programs. Wajiha and her husband, Muhammad Ashar, have been fantastic collaborators for almost 5 years now. They actually started, I believe, before residency. And I think the initial publication we had was back in 2019 or 2020. And we've been in touch, doing some projects collaboratively together, some mentoring along the way. So congratulations to both of you. Wajiha matched into Roosevelt Park, Muhammad Asher matched into Allegheny General, both great programs. And Muhammad Faisal matched into Cook County, INSEA matched to St. Luke's in Milwaukee, Sabah Batul matched in University of Texas Medical Branch in Galveston. Michael Shu was our resident at the Cleveland Clinic, and he has multiple publications in the last 3 or 4 years, and he matched next door to the university hospitals. Deputy, she matched to Rochester General. Cindy Lin was a resident local in a regional program here at Metro Health, and she actually matched in the main Cleveland Clinic program, which is fantastic. And I want to share this news that I just learned on Friday that my application for the academic title for professor just got approved. So I will have permissions to start writing professor from January 1st, 2025. And if you guys know Mushtaq Ahmad Yusufi, he's a kind of a funny scholar, but and this is his saying that once a man becomes professor, he will remain a professor regardless of whether he starts sharing words of wisdom. So on a serious note, I want to talk about, this is may not change day-to-day living for me, but my parents, had that dream. And so my parents, they're not living, but certainly they had really high hopes and dreams for me and my siblings. And I very clearly and vividly remember their kindness, their love, and their sacrifices they made for my growth and education. And I'm deeply grateful to Allah subhanahu wa ta'ala, as well as to my parents and family and teachers and mentors and colleagues and friends. And of course, patients. We are clinicians, so we learn from patients and families for their unwavering support, guidance, and kindness along the way. And I view this title yet another reason to continue giving back to the younger generation through support in whatever capacity I can do, through education, through their encouragement and the guidance. And all those people who wrote letters along the process, thank you to all of them. So this is the message I want to talk about, and then this is be my kind of last presentation slide. So I want you to be, a leader. I want you to think like a scholar. So you should be actively involved into doing something at a leadership level. Get involved into curriculum development, and it could be anything. Could be for pre-residency, for fellowship, for patient education. Find and share good resources for education, teaching, and learning. If you want to, go in the research and discovery tracks, emerge as a scholar leader. If you want to become a teacher, be the best lead teacher. Start reading, start writing, and be a leader in humility. Be a best person. Be a leader in respect and selflessness and service and positive thinking. So that was kind of every time I send an email back, I typically write, keep publishing, keep learning, and be a leader. So thank you so much. So I will stop sharing. So Wadia, your name was at the top. Why don't you take a few minutes and reflect on your journey and share some of the struggles and tips for the younger people who are now applying for the next match.
Sure. Thank you so much, Dr. Anwer. And congratulations, first of all, to you. You deserve this. I always look at you as my mentor, as I can say my father is not here in US, as my father, as my senior figure who I can count on. So thank you so much for giving me opportunity. So I can share briefly about my step exams and a little bit about my journey. That I did graduation in 2017 from Nishtar Medical College. My full name is Wajiha Ayman. So after graduation, I decided to do USMLE. I did step 1, step 2. It took me each 1 year for each exam, and to be more honest, for people who scored a little bit lower than usual scores, like 240s, 50s, everybody aimed at scores. But if you are in 230s or 220s, don't worry, I'm one of the examples. When I saw my scores, that was all I can do at that time. But afterwards, I didn't match in the first year of residency. I applied, but I didn't match, and I don't mind that, because that 1 year gave me enough motivation that I started working on research. I did a little bit research in 2020. I started working with Dr. Faiz Anwer, and I did few abstracts. That was, I think, 6 to 8 abstracts in first ASH conference. So after that, if I would have matched that year, I wouldn't have been matched at Roswell today. That's what my lesson is, what I learned after 3 years or 2 years of residency. So that 1 year, I worked hard. I tried to get into other research fellowships, because I had a little bit experience with Dr. Faiz Anwer, and then I published a little bit. And then after that, I got into Harvard Beth Israel Diakonus Medical Center for Sleep Medicine. That was 1 year research fellowship. So that also gave a little bit boost to my resume, because I had exact similar publication that second year. The only thing was added, I can say, a big name, a university name from US, which counts more for residency programs when you apply. So after that, in first match, I got 2 interviews for residency. In the second match, I got 8 to 9 interviews in internal medicine, and I matched in internal medicine. So after that, I kept working the same way. Me and Asher, we got married in 2021 after going unmatched. So after that, we stayed in touch with Dr. Faiz Anwer. If it's like a small advice for for residency, for pre-match, for anything, we were counting on him. We were calling him. So he stayed a very good sport all our journey long. And in this meantime, we never met each other in person. We never saw Dr. Anwer, and he never saw us. So we continued working with him. The first 2 years of residency, I would say, intern year, I was pregnant. I had the baby in December of my intern year. It was 6 months only. I did my residency first year, baby, and then along with that, I was doing research work. So once my baby started going to daycare from 6 weeks, I do feel bad, but for the mothers who are in medicine, who are going to be pursuing hematology oncology, I would say never feel bad because they won't remember that time. But once you are a successful oncologist, they will remember and they will say it proudly that my mother is an oncologist. So in the second year, we gave it a little bit lift. So I try to publish more. How Dr. Anwar keeps saying that keep publishing and be a leader. I tried to teach everything what I knew in those 2 to 3 years in my residency program. So that gave me a very good, strong base in my program that I became a research chief also in third year. And my publications were like 30 to 35 when I started residency. So at the end of when I applied match, it was 75. So I would say that 2 years gave me good time when I try to teach people. That leadership role also helped me to boost my CV, prepare my resume. And during preparing my fellowship application eras, as there are so many different topics, like you can choose separate specifications or separate characteristics. So I chose mentorship because I tried to mentor people and I published like 30 papers. In this all time, Dr. Faiz Anwer will be in my like 30 to 40 papers with me. So because whenever we don't have anybody in oncology, hematologist oncology, we will ask Dr. Faiz Anwer, can we use your sponsorship? Can you review this article? Can you review this article? Can you help us in this one? So all through, you have to have one person who can give you the best advice, who know that you know that this person I can count on. So Dr. Anwar was one of those persons. And Alhamdulillah, after that, I got 16 interviews in fellowship. And that was a mix of university plus community oncology programs. And definitely I ranked those university programs. I got interview from Cleveland Clinic. And I won't say that I'm unlucky that I didn't match there, because Alhamdulillah, I matched in Roswell Cancer Center, which is also great. So I would stay connected. I will keep publishing. And now my real struggle as an oncologist will start in July 2025. And I don't have to stop, because now it's the beginning of real hematology oncology from July. So I will keep working hard. Anybody who is going to pursue this career can reach out to me, and I would be happy to help anyone. Thank you so much.
Wonderful. So, Wajiha, why don't you take over and be the moderator
Sure.
and go ahead and invite the next person? But this was your passion, your hard work, and it's a track record. So I want people to pay attention to. You mentioned that there was a time when you did not match.
Mhm.
Definitely felt bad, but now
Right.
give credit to that year of failure, because then that helped you boost your profile. And now you end up matching in a very good, prestigious program. So sometimes we want something in life, but we don't get it right away. And there's always a reason. You will
Right.
likely know that reason maybe 5 years or 10 years, but
Mhm.
there's always a reason. That's my personal experience. So good luck and go ahead.
Thank you so much. Sure. So I can, Asher luckily joined. I can ask him to say something.
Sure, yes, thank you. Yeah, I wanted to keep my night empty, but unfortunately I had to cover someone, so I'm here in ICU. Uh, just a few things about my journey. It was more or less the similar one. I initially I was able to get good scores, and I thought it will be easy, and I will get into residency. Uh, but unfortunately, I also went unmatched during my first time residency. I was able to get interviews, but somehow it didn't work out. It didn't click. Uh, but that time, I was able to utilize to do research. I started doing research even before applied for the match in hemonc, because I knew I want to do hemonc. Sometimes you know it, sometimes you don't. But I did research in hemonc, and after that, I during that year I went to BIDMC, did a research year, dedicated research year, and then I was able to join the presidency. Um, in terms of struggles, yes, I went unmatched. Also, in terms of research, I feel like a lot of times we work on something and didn't work. I remember my first article. We wrote an article and we submitted it to Curious, that is known to have a very high acceptance rate. Uh, it wasn't a full effort, but still the effort was there, and we wrote first article. We didn't know how to write anything. Just randomly we wrote an article and submitted to Curious, and it got rejected. That sometime even when you write something good, things happen and it doesn't get accepted. Uh, and then we read about it, read more about it, and how things can be written better way, and then we improved on it, wrote another article and submitted it into actually a better journal that has an impact factor of 3, submitted there, and it got published. And then we kept on doing it, and the next article we were able to submit it in another journal that has impact factor of 6. We were able to publish there, and then we kept on publishing. So sometimes it doesn't happen right away. Even a lot of times we start questioning ourselves. We are putting in effort, we're putting in as much as we can, but still it doesn't click. But you never know when it's gonna click and when things will happen. So I would say, like, keep on writing, keep on putting in your effort as much as you can. If you do, you give your best, you will be able to achieve what you want.
Well, thank you so much for
Thank you.
sharing your story, and congratulations again.
Thank you.
So next we can do Insia Rizvi.
I'm sure. Assalamualaikum, everyone. So my journey is like a little bit different from other folks. Everyone has their own experiences. So basically, if we talk about, so I did my medical school from Ziauddin Medical College, Karachi, and when I came, I didn't take steps directly. There was a few years in between, and I took steps. I did reasonable. My scores were in 230s. But then, and when I applied for residency, I did get matched right away. But to be very honest, I was always a little bit confused between cardiology and hemonc. And because of that reason, I didn't do much publications or any outstanding electives or any specific experience during my residency. During my third year of residency is when I decided, okay, for sure, I really want to do hemonc. And by that time, it was kind of late because pandemic was there. Many of the institutions were not allowing outside electives. My own residency program did not have a lot of research support either. So what I decided was I took a different path where I started working at University of Illinois, Chicago as a sickle cell attending. And I worked there for 3 years. I'm currently working there as well. I did apply last year for fellowship, and I got like 5 interviews and I didn't match. And I didn't have, to be very honest, I didn't have that many publications or anything, and I didn't have a lot of research experience. I was working on few researches, but nothing was like where I was a PI. So after being unmatched, I heard about Dr. Anwar and I approached him. And we were just discussing this few days back as well. And he remembers my conversation. I was very depressed, very disheartened, as I was working as UIC as an attending. So I was expecting that because of my experience, I would be able to match. But then he started telling me like the same things that, try to be a leader, try to publish, and this 1 year you're going to learn a lot. And believe me, next year you will match. And then through the WhatsApp group that we have, I formulated a group where I worked as the PI and along with 4 other fabulous girls. Some of them have matched this year as well, along with me. So we worked on publications and on my own also with, I didn't only approach one mentor. I tried to pick up different people and some from UIC, some from other institution, and then Dr. Anwar was always there, of course. And simultaneously, like I formed groups with different people so that I can do more publications all at once, because I knew I had this 1 year where I have to, try my best and do my best and do whatever I can. And that's that exactly what has worked. And in addition to that, as I was mentioning, I was working as a sickle cell attending. So one additional thing that really helped me and that I would advise if you guys are interested in hematology or like in a disease like sickle cell disease, many interviewers were very much excited and interested in talking about heme experience because there is nationwide shortage for hematologists and especially for classical benign heme. So that actually helped me a lot because many programs were like, we are interested in a fellow who has this kind of experience. And, because a lot of time we say things in the interview, but we know that, down the road we can change our mind. But if in your resume they see that you are like maybe truly interested in hematology, then that is kind of like gives them a picture that this person is someone who will be interested in continuing hematology. And nowadays this is like a perk. People are looking, or the programs are looking for more fellows who are more invested or more dedicated towards hematology. So my advice would be like that 1 year when I didn't match, I thought this is the worst possible thing that has happened to me. But honestly speaking, if you utilize that, even that 1 year fully, you can accomplish a lot. And we have to believe in ourselves. And to be very honest, during this journey, I wrote it down in front of me when I used to work for research. There's a really cool saying by Nelson Mandela, and it's do not judge me by my successes, but judge me by how many times I fell down and got back up again. So this kept me reminding that we have to keep going. And if this is our passion, and honestly, in the beginning, when I didn't do any research or publications, I was very scared to even start. But once I started, it's like a passion, and you just get addicted to it, and you do more and more. So it's all in your brain. You think that it's hard, or you feel like, oh, I've wasted a year, or I'm wasting these many years. But trust me, if you have passion for this somehow or the other, you will get around and you will be succeeded. That's it.
Well, no, this was really great, and we wanted to hear. There are multiple pathways, so there's no fixed route. Now, I will invite Wajiha, with your permission. I see Dr. Rafiullah is here, and he's
Sure.
another staff physician, a consultant who has mentored many colleagues within this group as well. So, Dr. Rafiullah.
So thank you, Dr. Anwar, for inviting me to this excellent meeting. And I always actually look to you for guidance for my career advice. And I have been very successful, Alhamdulillah. So my introduction, I did my graduation from Khyber Medical College a long time ago, and I was the best graduate, Alhamdulillah. Then I did my residency back home and did some 1 year of GA fellowship, but then I wanted to come here to learn more. So I did my residency from Mount Sinai, New York. Then I went for hospitalist job because I was on H1, so I could not get I knew that I could not get fellowship, so I did not even apply for fellowship. So after I went to Wisconsin, actually, I liked the job and I stayed there for 5 years. So then it reduces my chances of fellowship. Uh, then I applied, I did not match. Then I started actually publishing. And I met with Dr. Anwar in one of the bone marrow transplant actually meeting in Orlando, and there I started publishing with him and did some publication. Then I went to University of Iowa for bone marrow transplant hospitalist job to improve my CV. So I worked with Dr. Guido Trico, who was one of the world expert at that time. And then after publishing with him, actually I applied for fellowship. Again, I did not match, which was surprising to me, but I kept on publishing and trying. Meanwhile, I did an MBA. So then when I applied second time, luckily I got many interviews and I ranked University of Cincinnati in my topmost choices, and I matched here. Then after fellowship, I was also the research chief because I had enough publications. And so I mentored some of my junior fellow and kept on mentoring some of the residents with Dr. Anwar as well. And we presented our work in Asian ASCO, and it used to be called ASBMT. Now it is TCT. So to cut long story short, now I'm the director of hematology service at the Christ Hospital. So I do still mentoring our resident here and remote mentoring to resident and candidates who try to get into residency. And I try to write a good letter based on the performance of the candidates. We are always there to support. And I have read Dr. Anwar letter myself as a chief fellow. He writes very good letters. So honestly, I learned how to write a good letter from reading his letters. So we are always there to help. And now my career path is I do hybrid, but mostly I'm in the hospital-based employed position, and I'm very happy and look forward for progression and mentoring. If you guys need my help, I'm always there to help to do career advice. One advice I would give, just be persistent, don't give up, even if you don't match twice or thrice. And the other advice will be in your fellowship, you should be very clear by the end of your second year that whether you want to go to academic or private practice or hybrid academic, because that way then you can build your career either in the leadership role. Like I have done MBA, so I thought I will be more suited for this position. That's why in my hospital, I sit on different committees and also director of the two program. And, I have like periodic meeting with the highest leadership in the organization. So they are also training me for higher position as well. But I don't accept the one other thing which I learned over the career, always have one mentor and discuss with them. Like when I was taking on these leadership position, I discussed with Dr. Anwar last year, and he said, go for it. You will be able to help more people if you are in a leadership position. So just be more like, know what you are doing. Sometimes it takes time, 1 year, 2 year, 3 years, but by the end of second year of fellowship, it will be better that you know where you are going for the future, because your first job will have a tremendous impact on your career. Thank you.
This was fantastic. Thank you for sharing. Vajiha, back to you. I think we should invite new fellow.
Sure. I think we are left with only Muhammad Faisal Aslam. Everybody else talked.
Hello, everyone. Assalamu alaikum. Thank you, Dr. Anwar, for arranging this. And I was just thinking, if there's a list of attendings who should get that title, you should be the top one on that. I'm so happy for you. Thank you, everyone, Vajiha, Asher, for sharing your experiences. And thank you, Dr. Afiola, for continuing to serve in this field. And your persistence is remarkably incredible. As compared to my colleagues who have matched this year, I think I had a pretty streamlined match throughout my residency and through the fellowship as well. I got good scores in step 1, step 2. And then I applied for residency. I got matched at Mount Sinai that same year. And then I went on, after 3 years of residency, I went on doing a J1 waiver job. I was on visa, so I wanted to get done with that visa to secure a green card before applying for fellowship. And I always knew that I have to be a hematologist oncologist because I've shared this with Dr. Anwar as well. I was 3 years old when my mother passed away from non-Hodgkin lymphoma. So I was very focused on becoming an oncologist. This year I started, in fact, last year I had got in touch with Dr. Anwar, and he got me in touch with another one of his student, and we started working on some research. I was able to publish. And there's a group of really good group that comes out from that WhatsApp group. And it really helps you. Everybody is motivated to become an oncologist, and that's very helpful. What I think I'd like to say, but I've realized in the meanwhile, when everybody's talking about research, which is very important, and I do believe I'm still working on a CAR T cell for hematologic malignancies article with Dr. Anwer. But which I think is another thing that's very important for fellowship, even for residency, is your personal statement and your interview taking skills. I matched the first time for residency program. I matched the first time for fellowship this year also, because I knew what kind of a personal statement I had to write. The thing is, people start thinking about personal statement at least 10 or 15 days before they decide that they have to apply for match. I think personal statement is very personal and should be very centered on your unique journey. I think it's an opportunity to share not just your achievements, because I've read multiple personal statements, and people are just a lot of times sounds like they're bragging about their achievement, but make sure you focus on your experiences, values, and motivation that shape your path. Make it a reflection of who you are and why you are driven to pursue the fellowship. Two of the fellowship program directors this interview season, when they told me, I mean, the first compliment was, Faisal, I read your personal statement, and I was like, I have to meet this person. And so because my personal statement was very near and dear to my heart, and I always knew that I have to write this personal statement, even before becoming a resident, I knew I had to write this personal statement. Another thing that I have realized throughout my path is, so people who are in community programs, I know in university programs, are more well aware when the conferences are, but I'd say if people who are planning to apply next year, I think they should sit down today or maybe next week, make a list of all the incoming conferences, ASCO, SOHO, LLM, AACR, all the conferences, their deadlines, what kind of an article that they can send there. I think that's an easy way to get more, I mean more quantity on your research resume. You can publish, you can post, you can have posters there, you can present there. And a lot of these conferences need membership. If you don't have a membership, I think recently I see Asfan is here. Asfan had to publish something in a conference, but he posted in the group if somebody can help, because that thing needed I think it was AACR that needed a membership. So make sure you have a list of all these conferences where you can go, where you can attend, and all make it count, make your abstracts, make your publications count. And just stay persistent, stay focused. Oncology, I believe it's very different from all the other specialties, because along with innovation, it demands a lot of patience and empathy. Make sure your personality, your personal statement reflect that you are compassionate as well as patient-centered. Highlight your ability, and I'm sure everybody will be able to match if you stay persistent and honest. Thank you.
Well, thank you so much for sharing. And if that's okay with you, and you can make some amendments, but please share your personal statement with the group, so they will also get inspired from your personal statement. So thank you for sharing your story. Vajiha, I see Dr. Raza, Shahzad Raza is a colleague. I think he's here. Why not we invite Dr. Raza for his perspective? Yeah.
Sure.
Sorry, can you hear me? Awesome, very good. I think everybody has explained pretty clearly why they are matched. And one of the questions we always ask is, why should I hire you? What is unique about you? And that's the answer. Everybody has to have its own answer, its own journey. And that makes a big difference, because, I think you guys are lucky because you understand what was missing in your CV, what was missing in your career, and somebody mentor you. So then you understand, okay, wow, this has to be done. Because when you come from the developing country, a lot of things we don't know how this needs to be done. There's a lot of misguidance as well. Oh, it's not going to work. And when we ask the students, okay, who told you this? My seniors told me. And I'm very surprised. And I'm that colleagues from our own country, is not telling the right things to the students. And that's a major problem that I'm seeing, that some of the students, they have a wrong impression. Maybe the colleagues were not sincere. So I have noticed this problem. Now, what exactly happening is, when you get residency training in the US, one of the concept was, okay, you cannot get the green card. You need to do, employer has to do it. Don't go for J1, go for H1B. And a lot of things can happen. In my case, I got the green card EB1 pretty quickly. Just did committed research for 2 years, published 45 papers, 6 months with I have a green card. So that's my career will be much easier because I had those skills already been set up. So I think this is important to know, that what are the ways of getting succeed in the career. Now, immigration definitely is important thing, because immigration can help you to go to the next level. So I'm not going to advise for others, because you guys are already very much knowledgeable. You know what to say, and you are in the field, so you know what students needs to do. But I have some tips for the students who match, because this is your journey just started. What we have seen, the problem is, like at this level, your publications are very basic, like case reports, review articles, and we think this is it. I don't think this is it. This is just a beginning. You really have to move forward from here to the next level. Your art of writing, your art of research needs to improve from here. Like from here, you need to have your own studies. You design the study, you have a critical thinking, how I'm going to do. If your program allows you to be participate in some grant writing, do so, those workshops, attend those conferences, and read about the people who are real scientists, like who've been working, how they are working. Make your collaborations through the LinkedIn, ResearchGate, and other things. Make your circle even bigger. So I think this is also very, very important at your level who match, because out of you, 90%, almost 90% or plus, your career will stop here. That's what I see all the time. Like, okay, I'm now hematologist, 3 years of my training. Obviously, you need to do shine in your training. You need to do the best in your training. But after 3 years, many people will say, look, I'm done. I have my life. I need to see patients, and that's it. And then this is reasonable. This is the very good career, because that's what you aim for, and that's what you're doing. But if you are one of those who really want to be also shine and be in speaker, be the leader among 10 oncologists, somebody pick you for that, I think then you need to work from here. Your journey starts from here. And that journey includes reading the articles. Every day you read one NEGM paper, read the blood cancer journal papers and JCO papers, and focus on methodology, how these methods were done, how it is being written. Because this is very unfortunate that even the fellows, when they graduate, we see their basic understanding is missing. What is called forest plots, how you understand that, what is the problem in these things. My first editorial was published in Lancet when I was not the resident. So I'm just telling you, nobody teach me. It's just by myself. And I'm going to tell you that nobody will take your hand and tell you how to walk. The kids learn how to walk by themselves. It's the nature. And this is what I want to tell you, that all of you, if you want to be successful from here, you need to stand up and you need to work, improve your collaborations, improve your research skills, and keep refining yourself. And, academics, private practice, hybrid, all are great careers, whatever makes you happy. But if you really want to be in side on the research side or academic side, please do it during your fellowship training, because after the 3 years, this is one of the important metrics we look for as a faculty position. What have you done? Which program was providing you in opportunities? And these 3 years get you learning better, like all the clinical designs, research studies, how they do it, basic understanding of that. Participate on those roundtable discussions, academic discussions. I'm telling you, that will take you to the another very different set of level. And not all of you will do this career, but if you really are interested in that type of career, please reach out to us, because I think this is what we practice and we still continue to practice. And if you do that practice now, I think you will be very, very successful in academia. Thank you.
Oh, wonderful points, Dr. Raza. Thank you. Vajiha, is there any new fellow? If not, maybe we should have, I see Abdul Rafe. He is now a graduating fellow in 3rd year. Why not we invite him?
Sure.
Yes, absolutely. First of all, congratulations to everyone on matching. I see some familiar faces I saw during interview at our program. So congratulations, and congratulations to Dr. Anwar as well. Well-deserved position for professor. Well, I think everyone raised very good points about being persistent, keep publishing, and stay focused on on what you want to do. So I would echo all those things, but also I think I would just like to add few things, some tips for the incoming fellows, what to expect, especially for someone coming out from a community program. I came from a community program. I did my residency in a community program and then came to UMS. So we did not get a lot of hematology oncology experience during our residency. So first of all, the residents who are still in residency and aiming, or in the community program and aiming for a hem-onc fellowship, don't let anyone tell that it's not possible. The keys are be focused, persistent, show them that what you want to do oncology, and how you show them is to do outside electives, research, all those things. But for the incoming fellows, the first few the first couple of months would be a huge learning curve. You will have this imposter syndrome. Do you really want do you really belong here? You can just go back and being a hospitalist. But because we don't see a lot of that, and then there's a lot of learning involved. So don't hesitate to ask questions. If you don't know anything, just don't pretend that you know and then think, oh, I'll just go and then read afterward. Just ask your attendings. Ask. Don't shy away from asking questions. The more questions you ask, the more, and then you can always go back home and read. But asking questions will actually help you a lot, getting some basic grip on what we are doing, what a lot of drugs that we use, why we use it, why we use it this way, why 2 years, why 3 years. So all those things, it's very important. And then so don't feel like that you don't belong, especially because this is normal. But as you remain persistent, focused during your residency, keep doing the same. Maybe just focus more on learning some basics, use some resources like ASH and ASCOSEP. Those books, if you want to read from books, I'm a book person. I like to read from books. And then there are many podcasts. Fellow Oncology is an awesome podcast where you can they teach you from the basics. So listen to those podcasts. That will help you, especially during your first few months. And then if you have a focus, that's what you want to do in your fellowship, just try to get it and get involved into that as soon as possible. If you're still undecided and you think, yes, that's fine, take your time, but don't delay it by the end of your 2nd year or 3rd year. As Dr. Rafila said, make up your mind by the time you're done with your 2nd year that that's what you want to do. And then one more thing, yes, for the fellows who are gonna apply for the match. I have been the part of interview panel, for our fellowship program for the last couple of years. I was talking with Dr. Anwar the other day, and he was like, I was saying, I'm seeing the CV is getting thicker and thicker with the publications. But another important thing is whatever you publish, just make sure that you have a thorough understanding of what it is. Because yes, many times some reviewers, some interviewers will ask you, oh, what's your favorite paper, what paper you're proud of, you can talk about that. But I have experienced that, one of my faculty who I was with, I was interviewing resident fellows, applicants with him. He just picked a random paper and asked, because it's in your resume, and they expect you to know, especially if you have tons of publications on one particular topic. So he just picked one of the myeloma article because he's UMS is they're very proud of their myeloma. So, and then I started asking questions. So know your stuff, whatever you're doing, make sure you know. Even though we work as a part of a group, some people do literature review, some people do, but be involved, know what you are doing, have some basic understanding of the disease process, so that you are ready when someone asks you those kind of questions in your interviews. So yeah, so those are the few tips for the upcoming fellows and for the applicants. And feel free to reach out to me for any sort of help. I connected with few people during the fellowship interview trail. And good luck to everyone.
Wonderful. Thank you so much for all those, good pieces of advice. Wajiha, I think we have Dr.
Salman Faisal is also here.
Salman Faisal. Yes. Why not we invite Dr. Salman Faisal?
Sure. Hello, Salman bhai, if you can hear us. I'm not sure if...
Yeah, not sure. Anyone else want to make a comment or ask a question? So it's been almost 50 minutes into the meeting. If Dr. Salman does not join us in another minute or so, then we will conclude our session. Tomorrow is the working day. And once again, take initiative, be the CEO of your success. You guys heard this team multiple times. The mindset should be completely different. It should be for your own growth and should be for the growth of people around you, and collaborate, learn and teach. This is now people who match. This may be the time now to pay back, and the payback will be now help the next person. And believe me, if you do that, you are not going to regret that. In fact, your personal growth will be enhanced multiple times, and that's the way to do it. So once again, congratulations, and we'll continue to collaborate. This is just the beginning of another marathon. Thank you.
That's true. Thank you so much.
Okay.
Thank you for arranging this, Dr. Anwer.
All right.
Thank you. Thank you, Dr. Anwer.